Hi, good morning. Could I have everyone's attention? I think we'll get started now. I know people will trickle in because of the snow, but it's good to get started and reward those of you who are on time. So thank you so much for braving the snow to be with us today. I'm Dr. Kate Tulenko, and I'm the director of CapacityPlus, which is USAID's Global Health Workforce Project. And I would like to welcome you to our workshop on transforming and scaling up health workforce education and training for health equity. CapacityPlus is USAID's flagship health workforce project, as I mentioned, and we work in 23 countries in Asia, Latin America, and Africa to make sure that every person has access to a qualified, motivated, and well-supported health worker. And we're a leader in improving the effectiveness and efficiency and cost-effectiveness of the global health workforce. New estimates of the global health worker shortage have reached 12 million health workers by 2030, so the estimates are even greater than they were before. And whether it's the World Health Organization or the Health Professionals for a New Century, most organizations involved in this issue think the solution's not just doing more of the same, it's not just scaling up an already broken education system. In developing countries, training doesn't prepare health workers for the reality of practice in actual clinics in underserved communities. They don't invest enough in schools at all. In pre-service education, students are given no management skills to manage the teams or resources or institutions that they will head. And in many schools, it's a common occurrence for up to 60% of the students to drop out before graduation. So that's a waste of 60% of the resources that are invested in education. In developed countries, many professions have driven up the cost of education so much that they basically price themselves out of training enough health workers, or they burden the graduates with so much debt that they have almost no choice but to practice in subspecialized metropolitan jobs rather than in the more life-saving primary care jobs in underserved communities. And in all countries, the admissions process often selects for wealthy metropolitan elites who are least likely to work in underserved communities. Admissions policies are based almost exclusively on academics, really ignoring the mountain of evidence that other skills such as communication and compassion are the most important skills for making an effective and successful health worker. And all of this is important because the health workforce students of today will face unprecedented changes in epidemiology, demographics, economics, and technology. The epidemiology changes will include the change in burden of disease from predominantly infectious disease to predominantly non-communicable disease, such as cardiovascular disease, diabetes, cancer, and mental health, and obesity. And the health worker student of today must be taught to be a self-learner and must be taught that knowledge has a shelf life. And what they learn today will no longer be true in 5 or 10 years, and that it will be their responsibility to make sure they keep their skills and knowledge up to date. The demographic changes will include global aging and urbanization. And not only will we have to adjust the curriculum of current health work cadres, but we'll have to create and train new forms of cadres who can help older people manage their health as well as manage their daily living, activities of daily living, such as bathing, dressing, and eating. The economic changes will include the economic transition of health, that in 20 to 30 years, most countries will be middle income or higher and will have a GDP per capita of $60 per capita or higher, which is above the amount required for a basic primary care package for all people. And this means that actually more money will be spent out of pocket in the private sector. We may see vast movements of healthcare workers out of the public sector into the private sector or more of a tension between the two. And so students need to be prepared for this. And as far as the technology changes, we'll see the adoption of the mobile phone as one of our most important tools in health, and the health worker students must be prepared for this. The mobile phone will be used for patient education, patient self-management, data collection, reporting of outbreaks and disasters, patient charting, health worker job aids, health worker education, and also connecting the health worker to her professional community. And mobile phones are already the most rapidly adopted technology in history. They've been more rapidly adopted than electricity, radio, or the car. And mobile phones must be integrated into health worker education so that the health worker views the mobile phone as an essential part of her toolkit and is as comfortable working with a mobile phone as she is with a stethoscope. And another important topic that we will discuss today is the metric of success for health professional schools. New metrics of success will certainly not be what you often hear. You often hear schools brag about the percent of their graduates who are practicing overseas. Instead, we will most likely see schools tracking their graduates to see whether or not they're still practicing in country and whether or not they're practicing in underserved communities. And hopefully school funding will be tied to this metric. So Rebecca Bailey, CapacityPlus's team lead for health workforce development, and her team have put together a wonderful workshop for you today. We'll hear from many of the leaders in the field working in pre-service education, including colleagues from the World Health Organization, the Nursing Education Partnership Initiative, MEPI Education Partnership Initiative, and FAMER. And we hope that in the true spirit of education, you will take what you learned today back to your home institution and apply it, and that you will pass it on to others. So without further ado, I would like to introduce Lois Schaefer, who is the USAID manager for CapacityPlus and the health workforce advisor at USAID.
I just want to add my welcome to Kate, and also my thanks for your braving of whatever the weather is out there right today. Just remember, Thursday is the first day of spring. This will come to an end, we hope. I would like to share with you just a few thoughts about what we're hoping, both within the project and from USAID, to get out of this meeting here today. What Kate didn't share with you, I thought she might, because it's such exciting news, is that originally CapacityPlus was slated to end in September of this year, and we have been able to give them a year's extension. So their new end date is now September of 2015, and we are so excited and pleased by that, having an opportunity to spend another year working together and consolidating the gains that have been made and looking in perhaps some new directions. So we actually started planning. This is one in a series of these half-day technically focused meetings. This is number 2. We had one a few weeks ago on retention and productivity, and there's a few more that are planned. When we first came up with this idea, it was sort of with a closeout focus. We wanted to share with as many people as possible the many great accomplishments that CapacityPlus has made in these specific areas. And that's all well and good. So but now we're looking for more, okay? We have a little more time than we thought we were going to have when we started this process. And so we're also looking for some feedback from you as you hear what is discussed here today, both in the plenary and at your roundtables. Some ideas of what should we hone in on in that final year? Is there some particular pieces that's going on that you think are worthy of maybe a little more attention or a little more energy? And don't stop at the final year. I mean, this is a big ongoing process that we're in improving pre-service education. So if you're thinking bigger, don't hold back. Share those ideas with us as well. It will be a series of roundtables that will give you that opportunity on different areas of CapacityPlus, and to meet with some of their partners. We certainly could not have done this without some very strategic and fruitful partnerships along the way. And so we wanted to invite at least some of the partners to come and share what they're up to in relation to both CapacityPlus and a little bit of their own as well. You know, in 4 hours, we wish we could have invited everybody and could done a very comprehensive view of what's happening in pre-service education in the world today, but that simply wasn't feasible. But we do have some very important and strategic partners. As Kate did, I'd welcome WHO, the World Bank, our PEPFAR's Nursing Education Partnership Initiative. It just doesn't roll off the tongue, does it? The medical, MEPI and NEPI is much easier. The Medical Education Partnership Initiative. USAID's SHOPS project will also be at a roundtable today. So please, we'll be hoping to get back from the leaders of those discussions some of what happens within their groups, and again, share those ideas for further directions within the next year and beyond. So I'm going to turn this over to our first panel, and I hope you enjoy the day.